Okay. Thank you, everybody, for joining us. My name is Chris Vogel. I'm the president of the Atlanta Area Evaluation Association, and this is our 29th consecutive journal club. I'd be really sad if I'm ever sick and not able to actually have one of these, because that's a good, strong number we're working with. Today, we are super fortunate to be joined by Jane Buckley and Monica Hargraves to talk about their article, The Relational Nature of Evaluation Capacity Building, Lessons from Facilitated Evaluation Partnerships. So a discussion about everything that was wonderful about that article. And before we get into that, I just want to throw out next month, in case anybody drops off early, we're having the wonderful Michael Quinn Patton join us to talk about his new article. I'm blanking on the title of it, but it's the one with how far should evaluators go in eliciting social change. I butchered that. And if you ever watch this, I apologize. But anyway, so with that, I will turn it over to Jane and Monica. Thank you.
So I guess, Monica, we will introduce ourselves. But since you just mentioned Michael Quinn Patton, I think when I went to a AEA pre-conference workshop of his in 2009, I think was the first time I went to AEA. And he's really someone who pays attention to relationships. It was a huge inspiration to me when I went to that workshop. And in terms of being relational in your capacity building and responsive and being a listener and having mutual respect, he's really someone to look up to and pay attention to the way he speaks about his partnerships and respects his partners. So little extra plug for Michael. I don't know why, it made me think about that. So I'm Jane Buckley. I live in Rochester, New York. I have been working with Monica since I think 2008-ish, maybe a little bit longer. And we started working together at the Cornell Office for Research on Evaluation. Prior to that, I was a community educator and actually a charter school teacher. My background's in human development and education. And I sort of went over into program evaluation around that time, 2006, 2008. So I bring a lot of educator-iness to my work in the field of evaluation, which I think is what drives, like, Sarah was mentioning my work on evaluative thinking, and also this work on, it's all about capacity building and understanding the learning process for people of all ages. And evaluation is a learning process. And capacity building is like learning to learn. So it's very meta in terms of education and learning. And I am an independent consultant here, and I have been since about December of 2015. So something like 4.5 years, something like that. So that's me. And if you have any other questions for me, you can ask. I think those are the basics.
Let's see. So some of Jane's basics cover me as well. We've been working together since 2008, and that's when I came to Cornell University and joined CORE, the Cornell Office for Research on Evaluation. My background before that is actually in economics, which I just kind of left, but carried a lot of that analytical thinking with me. In that transition from academic economics, really shifted to focusing on community-based work. And I worked at Cooperative Extension here in Tompkins County. I'm in Ithaca, New York, where Cornell is. So I worked at Cooperative Extension for a number of years. So I think somewhat like Jane, that grounding in community-based work, outreach, like real program participants, all those realities really gives me a sense of allegiance to program folks and informs the way I do evaluation. And part of what I like about our approach, the relational systems evaluation, is that it, although it's protocolized and has structure to it and a strong research foundation, a lot of it just makes sense. Evolutionary evaluation is one of my pieces in all of this. So that life cycle approach to programs and evaluation. Anyway, and I really like the way we do evaluation that really centers practitioner knowledge and practitioner expertise. They know their programs, they know their audiences and communities and funder issues and stuff like that. So, I was at CORE. I'm a couple of literally weeks away from having left Cornell. Jane for years has been saying to me, come on into the independent consulting world. The water's warm, jump right in. So I did at the end of June. So I'm actually not at Cornell anymore, but now, like Jane, I'm going to be operating as an independent consultant, doing much of the same work. So that's me. So
Monica and I just reread this article ourselves. Obviously, we wrote it a little while ago, so we needed to reread. So hopefully it's fresh enough in our minds, but I know we don't have very much time at all. So I think we want to spend as much time as we can on whatever you want to talk about. So if you have questions or ideas you want to talk to us about, please bring them forward. Just give us a prompt. We'll riff.
Yeah, there were a couple things I noted in here. One, the simplistic beauty of the analogy that you made on the second page, page 48. I guess I just never thought of that. This notion of a tailor, right? And how for their job, a lot of the time it is a prescribed fit, and then there is some tailoring for it, but it's fairly straightforward. But as evaluators, I keep thinking of our adaptive methodologies and all these things that make us unique and need to adapt to situation based upon our partners, the relationships we built. And I just really wanted to throw out that was a good analogy. I approve of that.
Well, thank you. We develop a lot of good analogies through Google Images when we're developing slides for presentations. At least I do. The images and analogies through images speak to me and help me as a presenter. So I don't know, Monica, if you have anything else. Fit is certainly a really, really important idea. I mean, fit is central to the idea of systems evaluation, because the idea of systems evaluation is that there's every program and every individual exists in a complicated system. And in order to be responsive, so there's that word again, or relational, which is a very overlapping word to responsive, you have to acknowledge the complexity of these systems. So yeah, again, it's not a simple, you're a small, medium, or large. You are a very complex system within a system within a system, who needs a particular thing in a particular moment. We do a lot with youth character development programs, and the idea of character is doing the right thing at a particular time in a particular circumstance. In other words, there's no such thing as the right thing all the time. What's a good example? I don't know, like something that seems like a rule, but then suddenly you're in a situation where breaking the rule is actually
standing up for yourself, which might be entirely appropriate and necessary in some circumstances and reflect character, might actually be really the wrong thing in other circumstances.
Correct.
So simple rules don't apply to that.
Correct. So similarly, evaluation itself and evaluation capacity building have to be very aware of the context. And when we say the word context, we mean that in a very multidimensional way.
Yeah, I'll just build on that a little bit and say that this idea of fit is probably one of the core concepts in the systems evaluation protocol. Fit, it has to fit the program. The evaluation has to fit the key stakeholders for that program. What do they need to hear and how do they need to hear it? You have to have alignment between the program life cycle and the evaluation life cycle. So there's that kind of fit. And it's, and that's also, since we view programs as dynamic and evolving over time, that's where you get this fluidity. And it also highlights the critical role of practitioner expertise and the need for partnerships, because just exactly for that, the reason why that Taylor analogy doesn't work. And I agree, that was when I reread it, it's like, that is a great metaphor, and it's definitely Jane's. So yeah, fit is at the heart of a lot of it, and anchored in the systems approach and the evolutionary approach. And so we have the protocol, which is standardized, very stepwise, sounds very rigid, but in fact, it's a protocol that's designed to be adaptive to all of these different components of a program.
But I think, and again, I want to leave space for your questions, but I think, historically, where did this paper come from? As Monica said, we've always cared a lot about evaluation partnerships. We've always called them partnerships. When we started back in 2008, it was like, okay, we've got this thing called the Systems Evaluation Protocol, and we're going to work with some programs to help them plan an evaluation. And I think very, very quickly, both Monica and I, and maybe in slightly different ways, but in a lot of overlapping ways, realized that even though there's a lot of special stuff in that protocol, especially around modeling your program and understanding the system and the stakeholders and all this stuff, that there's some stuff that's not in the SEP that is make or break, not just for capacity building, which is very close to our hearts, but for the success of any evaluation. So for me, there are two things beyond any evaluation, planning, technique, methodology, whatever. One is evaluative thinking, and the second is relationships. And that if you're not focused on those two things, my experience, maybe it's different for you, your chance of sustaining an evaluation or having a high quality evaluation being implemented, you got to have a positive, trusting relationship, and you got to have evaluative thinking, and especially for sustained capacity. So, and I would call those like primary and secondary, and the rest, no, they're all up there, but the rest of the stuff is sort of like comes after. If I don't have a trusting relationship with the program I'm working with, they don't want to hear from me about pathway models. And I don't know, does anybody want to speak about their experience? Tell us about your experiences with relationships and capacity building.
Well, just real quick, one of the questions I was going to, as I was reading it, I was thinking just how much this applied not only to ECB, but also to evaluation. And I don't do very much evaluation, but the people I do ECB to do evaluation. So I was sort of conflating the two, but one thing I particularly liked when you were talking back to the conversation about fit, that you went through the program called out the program evaluation standards to say a good fit is one that gets the right balance of feasibility, utility, all those. And I think for us at CDC, that's a hard concept to get across because the main thing valued at CDC is accuracy. It's hard to have people who operate in the research and science and epidemiology world all day really understand this need for feasibility to get something that's remotely accurate. I'm going over performance measure data today. So anyway, I really appreciated calling that balance out when you talked about fit. And I could go 14 directions because it was just great in so many ways. I loved, I did some work on reflective practice, and so looked at a lot of Brookfield's work, and he talks about you really do have to have multiple perspectives to get at learning and to get at critical reflection. So I really appreciated. To me, that's where the relationships come in. Part of it, there's this giant part about trust, and I just read it yesterday, and I don't remember all the characteristics.
I read it yesterday, and I don't remember either, so you're
right.
good.
So there was trust, but there's also the idea from evaluative thinking about getting the multiple perspectives, and you're not going to get people to give you their perspectives
if they don't feel safe. Right, and then yeah, and the idea of trust is very closely related to what some people call intellectual safety. Like I feel safe in this space to like share my ideas, that you're going to think I'm smart enough, or that my ideas have value, or that I'm not going to be criticized or dismissed in some way. And that's huge. If you're going to get to fit, you have to have some semblance of the truth about what's going on with the program and the program's context. And yeah.
And I think this just leads me back to another big context thing. I have been talking a lot about vulnerability because I was looking at reflective practice and thinking about vulnerability and like, oh, how important vulnerability is with respect to evaluation. And I brought that up in a team meeting. and somebody who, you know, I work more in the chronic area, even though I'm in environmental health, but I was talking to somebody who works more in infectious disease, where you've got a lot more medicine going on, and the idea of vulnerability, like at CDC, being vulnerable, there's a lot of privilege involved in being able to say, I don't know this. So to get somebody to trust you in an area where vulnerability is not really rewarded is, I think, a big thing. And I'll stop now because you just inspired so much thinking. Thank you.
No, but I mean, I think that's exactly right. And when we started in 2008, I was working with the folks I was assigned to do capacity building with were outreach educators from materials science research and education centers. And so pretty hardcore scientists. And so some of that is analogous to what you're talking about. Every context that we work in is different, and no stereotype obviously is true, but there's a certain thing about the culture amongst scientists or doctors. It's interesting. You're making me think about I was talking with some folks who were from Brazil, and I was talking about humility and how it's very important that so when you come in as an evaluation expert, people sometimes think, okay, there's this power differential and I must know more, or I'm going to be critical. And so I try to sort of have a lot of humility. And they said, well, that won't play in Brazil. You got to have confidence in Brazil. And I was like, fair enough. That's a really good point. You know, context to context, how it's going to play out. I still think intellectual humility is valuable. And I haven't found a context where that's not valuable, but can you be intellectually humble while also being confident? There's something to meditate on for tomorrow. You know, it's like, these sort of interpersonal skills are at the heart of it.
I just want to add one bit to that, because Sarah, your comment about the researchers sort of not being willing to bend in the direction of feasibility and that sort of program realities. As you could tell from reading the brief description of the PACE project that was the basis for all the data analysis in this paper, we formed these partnerships between professional evaluators and program teams. And Jane and I, we matched them up as best we could. And we really worked it. Like we kind of hammered at the ECBers to, you know, listen, to ask questions, to respect the expertise and so on. But one of the, and very satisfyingly, one of the conclusions at the end, the results we really found was that for the ECBers, many of them talked about, wow, I learned so much from the program practitioners about the realities of their work. Like, you know, we could talk about this kind of evaluation being ideal, but it's just not going to work because, wow, they could barely get to their meetings. They're so overloaded, or whatever the realities were. So that was just this big light bulb flash by having them actually work together. And it helped overcome that, you know, what you're talking about. And that's what frustrates practitioners so much, is this gulf of not understanding what each other's work, and it goes both ways, but usually the hierarchy, the privilege favors the researchers and the academics, and it's hard to unbundle that. So, yeah.
Anybody else? I like hearing from you. Do you have any other experiences that this reminds you of, or questions or stuff from the paper?
I had something I thought was interesting, and hopefully I'm not taking up other people. Okay, good. I thought it was interesting in the table 1, the positive characteristics and the negative characteristics, that the least frequently reported positive characteristic was role clarity, while at the same time, insufficient clarity about roles was the most common characteristic in the negative. It's reverse duality that exists, or inverse duality or something. And I
think you only notice it when you don't have it, right? That's my interpretation there, is that you know, we stood at Monica and I stood at the front of the room and we said, your role is this and your role is that, and here's your partnership and bon voyage. And so for some people for whom it worked well, they never thought about it again, right? And again, the way the questions were asked in the interview was very open-ended. We didn't ask, how did you feel about your clarity of roles? In which case they could have said yes or no. But I think for the people where role clarity broke down, then it became top of mind. So anyway, that's my interpretation of that duality. that when you have it, it's just taken for granted. But Monica, I don't know if you feel differently.
I think that's right.
That makes sense. Yeah.
Yeah, that's one of the, as we said in our disclaimers there in the end of the paper, one of the pitfalls of this paper is that we were working with responses to fairly open-ended questions. And we particularly didn't ask them to talk about what was bad, so that's certainly possible bias in this data. Although we do think for the most part, people who reported very positive relationships did experience positive relationships just through our observation. What else? I mean, I have one going back to the, as Monica was saying about the ECBers who had an aha. Sometimes I think our own vulnerabilities as ECBers, sometimes we feel this sense of, gosh, they think I'm an expert. I have imposter syndrome. I better act like an expert. And now you've shot yourself in the foot because your puffing up to be an expert is actually the opposite of what the relationship needs. So again, have expertise without necessarily having to be an expert in terms of a persona. You can have expertise and a balance of confidence and intellectual humility. It's not easy.
Yeah, it's funny, as I actually had what I thought was a moment to read this article yesterday, and it was so nice. And as I'm reading about these characteristics, one being, what was it, like responsiveness. So I'm reading through these characteristics, at which point I get an email from someone whom, we're divided out and support different states, from someone I'm ostensibly supporting. And she's like, so that thing I asked you to review and get back to me by July 1st, do you have it yet? And I was like, oh, Okay, so I'm hoping that by sort of, there was something I was thinking, by being trustworthy, because I've read some bell hooks and some other Adrienne Marie Brown who talk about honesty all the time. And a lot of times it's easier just to say, oh, I didn't get that email. But, I wouldn't do that. But I was sort of balancing, okay, this is sort of by saying, oh, I can't even find that. I mean, I know I got it. Clearly, I could see I was in the email. I couldn't find it to find the attachment. But so I was sort of balancing the idea of trust and transparency with just saying I flat out, I was not responsive.
Yeah.
So
I think the quality of responsiveness is more important than the quantity. Or, I mean, I appreciate a timely response, as Monica well knows. I'm not very patient when it comes to people responding to me. But when I think about the word responsiveness, I'm really thinking about, some of the stuff that you're talking about with Stephen Brookfield. I mean, real listening. What does it mean to be responsive? Well, step one, this is like Psych 101, right? Like step one is you have to be really good listener, careful listener. You have to use reflective listening. I'm hearing you say, is that correct? I think the sort of help I could provide or that you might need in this moment is X. Is that correct? That's responsiveness, is it's flexibility, listening, action, action that with consent, it's like, that's what I mean by responsiveness.
Being willing to change.
Being willing to change, flexibility. Yeah.
Yeah. Well, in this case, I interpreted it as
responding to an email, which is a form of
Yeah.
All right, Manuel, Maddie, Stephanie, Zan, Jessica, anyone else?
Yeah, I'm
Yeah,
just listening.
wanted to.
Oh, sorry. Go on, Stephanie. problem. I don't have anything to add right now because I am multitasking, but I am enjoying hearing the conversation and nodding my head furiously as everybody is talking. So,
Well, thank you. We appreciate the description of the nodding we can't see. We appreciate that.
Hi, this is Dan. I'm an assistant professor at Florida State University. My pronouns are they, them, and theirs. I teach for the medical school, and I've been the Florida Asthma Programs evaluator for about a decade now. So I've worked a lot with CDC. I wanted to make sure to come to this journal club today because I really have found in my own evaluation work that good relationships, strong, trusting, nurturing, equitable relationships are at the center of all good evaluation. So that's really what I've prioritized in my work as an evaluator with the asthma program, and also over the past few years with our REACH Geriatrics Workforce Enhancement Partnership and ACTS 2 Black Dementia Caregiver Support Programs here at FSU. So I was really, really pleased to see folks choosing this article on nurturing relationships and evaluation capacity building, because through a lot of different experience and a lot of, I would say, thoughtful trial and error, we've definitely found that if you nurture those healthy relationships and really seek justice and I guess positive motivation in relationships, make the process of working together not just inclusive and affirming, but also rewarding.
Yes.
The rest kind of comes more easily.
That's exactly right. And it's and in a very altruistic, I could not agree more. So I'm glad we have the same experience. And in an altruistic way, it feels good to help people, and it feels good when that they feel good about it. But in a non-altruistic way, it's like an ounce of prevention is worth a pound of cure. It's like if you invest in the relationship, the evaluation work flows. You're making your life easier because now there's this like intrinsic motivation with your partners. You're working together more easily. It's not as much of a struggle, is what I find. So
absolutely. Yeah. And I think we've seen that during the pandemic, especially. Folks were ready to come to the table, think creatively, adapt, and support each other.
Yeah.
So those strong relationships, if you can put your energy into one thing, put it into that.
Yeah, I agree. And Manuel, I want to make sure you get a chance in case.
Yeah, I got invited by Sarah, and through my email, I'm the asthma program evaluator for Puerto Rico. So I do evaluation here for the asthma program, and we give feedback to the CDC, and we have our project officers and everything. So we do constantly evaluation. I have a master's degree from the University of Puerto Rico in research and evaluation. So they combine both fields. So it makes it a complete multidisciplinary discipline. Yeah. So it's a real, we do a lot of things. Also we do analysis in business administration. So it covers a lot of areas. So it makes it a little bit more complete in within the evaluation. So, but I saw the title of the paper. I couldn't read it, but the topic and the theme was about what you guys were talking about. It's really true. We can see it with our collaborators and stakeholders here in Puerto Rico and the asthma program, and it's really important that communication, that the stakeholder or our participants or program participant feel empowered, and that they can communicate their necessities. So when those things come along, the evaluation flows. So yeah, we have seen it firsthand. So
cool, thank you. I went to Puerto Rico a couple times in my days as a STEM community educator.
oh, okay.
I think I might have been at University of Puerto Rico. I was somewhere. It was a long time ago. Anyway, sounds like a very cool program. I'd love to see the syllabus of the classes you had to choose from. It's like, anyway,
we have to do thesis. It was a 2-year program, and plus the thesis. So we have to run everything, and in 2 years. So yeah, it's a little bit intense.
Yeah.
Yeah.
I just want to jump in real quick. I know we're running out of time, but I'm Jessica. I'm interning with the Illinois Asthma Evaluation Program this summer. And so I'm relatively new to evaluation. I work for a DHS funded grant. So we work with evaluators in substance misuse prevention. But reading through this, even just with my like little experience with it, I was like, this is 100% correct in everything, and the relationships, and having to know, you know, like we have one big grant from DHS for substance misuse prevention. We have the guidelines but we have to adapt it to our community because our community is different than the other ones. So I just thought it was awesome all the way through.
Well, thank you. Yeah, I mean, it's a really good point. There's like the point I made about these folks from Brazil. And there's also a point we make in the paper, which is, I don't remember the citation off the top of my head, but that positive relationships or productive relationships in evaluation or in a professional setting don't have to be the same as like loving friendships, right? It's like they can be, but these characteristics of responsiveness, mutual respect, trust, etc., you know, they play out differently, as you're saying, Jessica, like depending on the community and the people that you're working with. And as Monica and I have been lucky enough to work with people from around the world, from completely different, you know, cultures, from a social, political, language, and every way different, as well as all the microcultures that exist in our local communities. But what does it mean to, it's so fun and interesting when you have to be very careful and willing to listen and respond when you meet a new person, a new program that you're going to partner with. Okay, wow, what is it going to mean to be in a positive, productive relationship with this group? Because it's not going to mean the same thing as last time. I'm still going to be me, who's kind of goofy and a sense of humor and stuff like that. How's that going to play with this group? What do I need? How can I make sure that I'm responding to them? You know, so it's hard and fun.
I think one of the things that we have to figure out on all sorts of accounts is when you're working at the federal level, with, you know, the asthma program funds 26 or 28 grantees, and you're trying to work across that, and we're also in the position of representing the funder too, and so that adds another bit of context.
I think there are relational connections, and you must be living them between funders and programs as well, that can strengthen that relationship. But then there's a bunch of other complicated, very built-in power issues. Who has the money and who wants the money? But that too benefits from relational approaches.
Absolutely. I mean, helping people understand that whatever I think about this has no bearing on really the funding at this big program level, you know. So,
yeah, and we didn't really talk about this in the paper, but intervening with a large organization that has multiple levels within an organization, which we've done this, you know, like we're supposed to support the field level staff and the middle managers and the administrators. And you have to know something about the interrelationships between those, not just those groups, but those individual people, before you can design an effective intervention for an organization with that kind of structure. Like, so for example, I was in Ethiopia with Catholic Relief Services. They have a very hierarchical sort of culture where you don't question, you don't pose thoughtful questions to your boss, you know. So we design an intervention where we work with those groups separately, because otherwise they can't be comfortable in the same room practicing, for example, evaluative thinking skills. Right. So again, that's a way of being responsive, is understanding what's going to work across a group with many people, optimizing participation, not always maximizing participation. Who needs to be in which conversation and why, you know, and how to set those priorities, all because of relationships.
Yeah, I want to go on that thought. Here in Puerto Rico, like Sarah was telling, we have the grantee, right, from the CDC for the asthma program, but we have to be also responsive with the health department that we work for, also the state health department. So not all of the staff members or the people that are higher above us, administrators and secretary auxiliaries, they don't necessarily understand, right, our what we do based on our objectives, our missions that we state with, that we implement or we establish with the CDC grant. So we also have to like have a happy medium and be responsive on what we want to communicate to our state health department. So yeah.
All right, gang. I don't want to cut the conversation short. I just want to be respectful of people's time. Always a great conversation on these calls. I love them. But with that, I was going to throw out if anybody has any final comments or questions. And then we can wrap it up.
We'll say a genuine thank you. It's an honor and really fun when someone says, do you want to come talk about your paper? And then you get to see real human beings who read your paper and liked it. That's always nice. So thank you, Chris, for the opportunity.
No,
What a treat when you get to talk to the authors.
thank you both, Jane and Monica. Yeah, it's I love hearing it from the horse's mouth.
I'll take it.
And we loved it. We love the article. Keep up the great work. You're making the field better.
Thank you so much. All right. Good luck to you all.
Yeah.
We'll see you again, gang. And remember, third Wednesday of the month, same bat time, same bat place. We'll be here. All right.
Thank you.
Bye.
Thank you. Bye. Have a nice day.